along the jaw and in the neck, like Daxxify? Can you use the toxin there, and what would it do for you?
It would do great things. As you can see right now, I haven't treated my neck recently, and so these are very strong, and they actually innervate right into my jawline. So if I inject along here and I inject into my platysmal bands, I will get a slight lifting of this jawline and look a lot more structured, or snatched, they like to say these days. And then with the marionettes, I do actually have Daxxify in my DAOs right now. This depressor, I cannot frown. This chin does not come up, so it's not creating this fold. And that's all thanks to Daxxify.
So yeah, so it can help with the marionettes, it can help with the jawline, and it can help with your neck.
Yeah, it just
Platysmal bands. Yeah. Okay, perfect. I get Botox in my chin for the dimples that I have there. Would Daxxify work?
Yep. Right here.
All right.
I don't have dimples.
I love that.
Thank you.
All right. And then also a filler. Can I use a filler in those vertical lines in the eye above the eyebrow? Ooh.
Yeah. We get questions about filler for the forehead area quite often. It's not something that we offer here at our practice for safety reasons. We will have other alternatives, of course, a toxin to help soften the movement, and then we'll go into proper skincare and laser treatments. We have over $1 million worth of equipment here, and we just have safer alternatives for you.
And just a friendly reminder, everyone that's in attendance tonight, at the end, you'll be getting a text, and just make sure you reply with RHA to that text so you guys can get a consultation, because you guys will be able to schedule one and learn a little bit more about the products and what's best for you. A couple more. What filler for deep wrinkles in that brow area? So I'm not sure if we're meaning here, but that's not an area our office offers. So do you want to speak to why we don't offer it?
Yeah, typically we don't inject filler in this area. We'll often tell you to get that muscle to relax a bit, because your glabella muscle, the one that creates those 11s, becomes very strong as we age. So we want to get you on a good protocol where you're coming in every 3 to 4 months so we can relax those muscles. If we were to inject filler in this area, there's some very essential vessels in that area that actually connect to your eyeball. And if we were to get filler into that vessel, it could perhaps compromise vision, would be one of the main concerns. If that's something you're really interested, I would suggest seeing a cosmetic or plastic surgeon with a very good rapport to do filler or fat transfer with them. But we have, as Erica was saying, we would get you on a good toxin protocol. We have plenty of lasers and other devices to use to help treat these lines.
What about RHA in the chin?
Yeah, we can do RHA 4 deep onto bone. We can also do RHA 4, RHA 3 into that mental labial crease that runs along here. We can do it in front of those marionette lines as well to give you a nice smooth chin and make everything just come together very nicely.
Okay. And then what is the difference between RHA and Radiesse?
Okay, so RHA,
big difference.
Yeah, big difference. RHA is hyaluronic acid. Hyaluronic acid is found in your dermal tissue. It's found in our joints and our eyes. So it's, and the way that they've constructed it is very similar to the way it naturally occurs in our bodies. Whereas Radiesse is a compound called calcium hydroxyapatite. So it's a lot firmer. It leaves a matrix under the skin to help stimulate collagen and elastin. However, it is not reversible. Even though it only lasts 18 months, you cannot reverse it once it's placed. RHA is actually reversible because it's hyaluronic acid. We have Hylenex, which can reverse it. If there were some adverse event like filler going into into a vessel. It's something that we can reverse. In my opinion, it is a little safer. There are benefits definitely from Radius, but when it comes to all over filler treatment, whether it be the lips, nasolabial folds, temples, jawline, I'd much rather go with a hyaluronic acid like RHA.
Yeah, I think Radius is a beautiful product in my opinion. I do agree with everything you just said. And I do think that it takes a specific patient to be a good candidate
Absolutely.
for Radius. If not, you can get very Maleficent.
Very Maleficent.
Which I'm all about. But it's a great product. You really just need to pinpoint what your aesthetic look is going to be.
Yeah.
Somebody asked, is Daxxify better than Botox? Ooh.
Aggressive.
Well,
I think it just depends
I think
on
it
the
depends
patient.
on, it's subjective.
Yeah.
Depends on what you like. So, like we were talking about this area, if this 11s area is an area that bothers you, then yes, it probably is better than Botox in terms of longevity. But it is going to last longer, so 4 to 6 months. So I would probably suggest that, I don't know if I would suggest you do Daxi like your very first
time.
treatment.
I've been receiving toxins for I don't want to say how many years, but I definitely think that I would only recommend Daxxify after you've had the experience of having your first toxin treatment.
Make sure you like it.
Make sure you like it because of that specific longevity, and then educate yourself. Allow us to help educate you. Go in and look at the clinical studies, the background. It has a lot to do with what personal preference you're going to have. There are beautiful products. Botox has been out in the market for a very long time, so you can definitely find a lot of literature and research on it. And Daxi, it really stands out on its own. So I would just allow yourself the opportunity to just get to know both and see what you're interested in.
But if you like your Botox and you're like, I wish it lasted longer, then definitely go with Daxxify.
Yeah. Let's do this question before we wrap it up, but where would you not put Daxxify or RHA? I feel like you kind of touched on that, but if you want to just go over that really quickly.
Okay. So some of the questions that we went through, we wouldn't be putting it like into this 11s area, not into the forehead. We just have some very important vessels that connect to our
That's the filler.
That's the filler, the RHA. We don't really want to be putting in that area. Daxxify. Some people will ask me, oh, can I put Daxxify here if I'm trying to calm down my nasolabial, these smile lines here? And I'll ask them to smile for me because I want to see if they have a gummy smile. Because if you don't have a gummy smile and I put some Daxxify right here, I'm going to drop your lip over your teeth and you're going to look like this.
Not cute.
It's not cute.
It's not cute.
No, so a lot of the times, like Daxxify can be placed in a lot of the areas that we treat you with Botox, Dysport, pretty much everywhere that we treat with those. But I'm not going to treat you in an area that's not right for you and not going to benefit you. And we mainly only do aesthetic neurotoxins here. We will do it for bruxism if you have, that grinding and clenching. We can use it for that. But I'm not going to do it, all throughout.
More therapeutic.
Yeah, I've had people ask me like, oh, can I use it for my bladder? Do you do that? Do you do
Not today.
these specialized areas? I don't feel comfortable injecting those. You'd have to find a specialist for that.
And then who are our injectors? Well, we have several. Adina does all injectables, Soft Wave, Morpheus, all the goodness.
Specialty treatments.
Specialty treatments for sure. We have Casey, Erica, Kylie, not this Erica, the other Erica. You don't want me injected. Casey, Kylie, Shelby, April,
Emma.
Emma.
We just brought on a Spanish-speaking injector.
Mhm.
Ali Bet, you'll start to kind of see her come in.
Yeah.
So we have a great handful of
Yeah.
injectors.
We have quite a bit. So, all right, guys. So we're gonna wrap it up. Do you want to close this out, Gayane, with our
Yeah, of
specials
course.
and the giveaway?
So thank you all for joining us and taking the time to ask some wonderful questions. We appreciate that. We are going to honor that 35% off for all of our participants. You're welcome to send us a message or call us in regards to what you would like to purchase. We will have a lucky winner for a Daxxify treatment, and we will have someone lucky to win a syringe of their choice of RHA. Of course, your injector will help guide you towards what's the correct option for you.
Mhm.
Thank you so much, and we hope to hear from you soon. Bye-bye.
Thank you. Bye-bye. Have a good night.